A very good afternoon, everyone. This is Pahachai there with you from Prime Medical Center Barsha. We welcome you to our live session, an important live session that is very much required. A live session where we will be live and asking questions to our doctor. I have here with me Dr. Ravi Teja, who's a GP, general practitioner at Prime Medical Center Barsha, with an extensive experience of 12 years in the field. And Dr. Ravi is going to talk about dizziness, its causes, assessment, and treatment. A lot of people have headaches, and a lot of people, feel dizziness. So much of the information is required to give to the people. I should say, an awareness, more of an awareness that is very much required. And Dr. Ravi is going to talk about it today. The topic, actually, if you have any questions coming in, please put your questions in the comment section, and Dr. Ravi will be answering them live. We also had some questions that have come during the registration, and we'll be asking all those questions to Dr. Ravi. So, Dr. Ravi, thank you very much for joining us today in this very important live session. Dr. Dizziness, causes, assessment, and treatment. These one problem has causes. We need to look into the assessment. We need to look into the treatment. It's a vast topic. Obviously, we'll be looking at the general part of it today, which is very much required for people to understand and to know, so that they can definitely consult the doctor if they really want to. So I would really, go ahead. I would request you to please go ahead with this and let us know about this important topic. Thank you.
Thank you so much, Fahad. Very good afternoon and warm welcome to everybody to this exciting session on dizziness. I'm Dr. Ravi Teja. I'm a general practitioner working in Prime Medical Center Barsha Heights branch, and I warmly welcome you to this exciting session. And why are we talking about dizziness? Why is the awareness on dizziness so very important? I would like to emphasize that it is a very common symptom. It's the third most common symptom with which the patient comes to the outpatient clinics annually. And according to American Association for Family Practitioners, 5% of total outpatient visits are with this complaint of dizziness. Now, what do you mean by dizziness? What is dizziness? Dizziness, broadly, we can say that it is a lack of spatial orientation. And how do you actually, what are the symptoms that can cause that dizziness comprises of? Based on the causes and the sensations that the patient complain on, we can broadly classify dizziness into 4 categories. The first category is vertigo. What is vertigo? Vertigo is nothing but an illusion of patient spinning around himself, or his surroundings are spinning around him. And the vertigo can be caused, we can further classify it into central type and the peripheral type. The peripheral type of vertigo is the most common that we encounter during the GP visits, and the peripheral vertigo is often associated with autonomous symptoms along with dizziness, like nausea, vomiting, sweating, and this is usually associated with the ear problems. And these peripheral vertigo, the episodes are very brief, lasting from few seconds to few minutes, but they are usually more severe in nature. But these symptoms and the peripheral vertigo causes are usually treatable and not so dangerous. Whereas the central vertigo is commonly caused by some inherent problem with the brain or the vessels, which can have a grave consequences. But the symptoms are not very serious, but it lasts for a longer duration of time, but the symptoms are usually mild. Let's get back to the classification on the symptoms. The second type of dizziness with which the patients come is disorientation or the disequilibrium. Disequilibrium is basically nothing but loss of balance. And the third type we normally encounter is nothing but the presyncope. The patients often complain that they are feeling a sensation of impending loss of consciousness. This is another common complaint, which is a symptom of dizziness. And the fourth type is lightheadedness. It's a very vague symptom. It's often related to the distraction from the external environment that patients relate to. Now that we have already classified the symptoms, let's get to the actual causes of dizziness. The most common cause of dizziness is BPPV, we call it. It's an inner ear disorder, wherein patients tend to experience dizziness when there is movement of the head. And apart from it, there are other inner ear problems like Meniere's disease, wherein fluid is filled in the inner ear that can cause ringing sensation in the ear or hearing loss, along with dizziness that the patients complain of. Apart from it, the most commonest problems associated with dizziness are low blood sugar or hypoglycemia, low blood pressure called hypotension, any trauma, any head injuries, and stroke. That's one of the major problem if seen. And other commonest conditions that we encounter on a day-to-day basis are pregnancy, menstruation, any chronic blood loss, and heat exhaustion, especially with the climate in UAE. We encounter, especially during the summers, we encounter a lot of heat exhaustion, dehydration patients, and these are, and anxiety, migraines, even these can trigger disease spells. Another commonest cause is medications. Talk to your doctor if you feel that any of the medications might be causing, because many of the medications like muscle relaxants, your antipsychotic medications can actually trigger this particular disease spells. Now that we have done with the causes of it, let's talk about what are the do's and don'ts when you are having or experiencing a disease spell. When you feel dizzy, it's advisable that you remain calm and you remain at a place and rest yourself until the disease spell subsides or until you get a help. Never drive while you are having a disease spell. Never consume alcohol. Never consume tobacco or caffeine when you are having a disease spell. Always and hydrate yourself. Hydration is another important thing that everybody needs to be doing once you are experiencing a disease spell. And if you are further got your help from the practitioner, it will be very nice. And when do you call a doctor when you're having a disease spell, or when do you put an alarm button? When you are having disease spell associated with a severe headache or a fever and a hearing loss or a drooping of mouth, tingling or numbness sensations in the body, or when you are having any visual disturbances, you're having neck pain or any head injury, these will be the times when you immediately call your general practitioner or your doctor. Also, when your symptoms are getting worse and the frequency of your disease spells are getting more and more over a period of time, that will also be a time when you need to speak to your doctor about. And what do you expect during an appointment when you actually book an appointment with a general practitioner? What do you expect when you come to a doctor? When we normally take the complete history, including when it started, how it started, any pre-existing factors that are there, any aggravating factors, relieving factors, we will try to find out the cause of it. Also, we will be doing a thorough ear examination, as well as your eye examination. Apart from it, we will be doing a cranial nerve, complete neurological examination in general, and we will be also getting an ECG done. If any circulatory causes are needed to be ruled out, then we will be referring you to a cardiologist for a 24-hour or 48 hours continuous ECG monitoring. And apart from it, if any inner ear problems are further need to be evaluated, maybe a CT or an MRI could also be advised. And depending on the cause, we will plan for the further treatment. And before I get to the treatment modalities that are available, I would like to emphasize on the common remedies that are available to treat the disease spells. Ginger is proven to be efficacious in treating motion sickness, which is also a very common cause of dizziness, and especially the nausea during pregnancy can also be treated by having ginger. And hydration, of course, immediately once you feel a disease spell, we urge you to have ample fluids. And vitamin C is proven useful in treating Meniere's disease. And as many people must be knowing, vitamin C is more in citrus fruits and bell peppers, strawberries, etc. Vitamin E is also very beneficial in actually maintaining the elasticity of the blood vessels. So if any circulatory causes are causing the dizziness, vitamin E supplements might be useful. And apart from it, if the cause of your dizziness is anemia, which is either caused by the iron deficiency or by the B12 deficiency, anything, an iron pill can be prescribed to you, or along with that, you will be advised to take foods rich in more iron, like dark leafy vegetables, etc. And apart from it, you can also take vitamin D with the calcium. It is actually proven to be useful in treating BPPV, which, like we have discussed, it is the single largest cause of dizziness presenting in patients. And it is proven to be efficacious in preventing the attacks and also the healing process as well. And now that we are done with the remedies, we can talk about the treatment modalities right now available. Treatment is largely cause-based. When we will try to identify the cause and try to treat it, like if the patient is having an anxiety episode, treat with anti-anxiety medication. If the patient is having a migraine, treat with anti-migraine medications. If it is anemia, treat the anemia. Apart from it, there are two classes of medications that are available, which are antihistamines and anticholinergic medications that focus mostly on the episode of dizziness rather than on the cause of it. So these particular medications are prescription only, and then they are available for the patients. Over-the-counter antihistamines are also available, which sometimes may not be that fruitful in treating the episode of dizziness. And if the BPPV is identified, the benign paroxysmal positional vertigo, again the single largest cause of dizziness spell, if it is diagnosed, your ENT surgeon or your general practitioner will teach you an exercise which is called as Epley's maneuver. Basically, it is both curative as well as diagnostic in cases of BPPV. And acupuncture is also proven to be efficacious in few cases of dizziness. And there is a physical therapy called vestibular rehabilitation therapy. It is also proven in cases of peripheral vertigo. After that, after we have discussed everything, how to prevent it is a next important question. Stay fit, hydrate yourself properly, abstain from having alcohol, any more of caffeine, more of tobacco, abstain from them. Start healthy practices like yoga, tai chi to keep you active as well as fit. And apart from these, talk to your doctor if any medications are causing these episodes. And beyond that, if still the episodes you are having, then that will be the time we'll have to go for further evaluation. I thank you all, and I'll leave the floor for questions.
Thank you very much, Dr. Ravi. That was a very well explained dizziness, its causes, assessment and treatment. As we are looking forward for questions coming in, so that we can ask Dr. We've got a question here from Dr. Asiya Nabi, and she's asking, can dizziness be a sign of an emergency as well? If yes, then what is important for anyone to know?
Yes, a dizziness could be an emergency as well. Like I have already mentioned to you, there are alarm buttons when you are having a dizziness associated with a severe headache or a visual disturbance or a drooping of the mouth or paresthesia, like tingling, numbness sensation. It can actually tell that there is something in the body, in the brain, or which can lead to a stroke, which is actually inherent and it needs to be immediately managed. So that will be the time you need to go for immediate evaluation by the doctor.
Great. Thank you so very much for the answer, doctor. We've got a few questions, as I said earlier, that has come before, during the registration. Doctor, I would like to take a question from there. Does COVID-19 cause dizzy spells, and can lack of sleep trigger vertigo?
That's a very good question. Actually, according to NCBI study, there is a direct correlation between the COVID-19 and the disease spells, because it is proven that in a case study that the proteins, the direct attack of the COVID-19 can be on the neurotransmitters, which will lead to the disease spells, and this lack of sleep. Yes, lack of sleep actually triggers an increased sensation to light and the hearing. So because of that increased sensations to the hearing and visual sensations, lack of sleep can tend to trigger the dizziness. Yes.
Great. I've got a question here from Ms. Sunita. She's asking, what tests do I need to determine if I have vertigo?
Okay, coming to the vertigo, it's firstly the brief history as well as a thorough clinical examination that would determine what sort of tests that you will be needing to undergo. Like I told, if it is central vertigo that is being in the scene where the patient is encountering a prolonged episodes of dizziness, and we are having some other neurological causes, like then we need to go for a CT MRI to determine the cause in the brain, and if it is a peripheral cause like BPPV or any vestibular problem, then that will be the time hearing tests and everything we need to be done. Again, coming to the circulatory causes, we need to check with the ECG. Electrolyte imbalances need to be checked for. Anemia need to be ruled out. The hemoglobin is becomes very important. And apart from these things, it's largely the cause. Identification of the cause is very important to see how is it going to be.
Great, thank you, doctor. Once again, before asking the next question, if you have any questions who are currently listening to us, all our viewers, please go ahead, ask your question in the comment section. If you're watching from YouTube, you can ask your question. If you're watching from Facebook, you can ask your question in the comment section, and Dr. Ravi will answer those questions live at this time. Doctor, coming to another question that has come actually during the registration. Can blocked arteries cause dizziness? And is dizziness a symptom of low blood pressure?
Oh yes, actually the blocked arteries can cause disease spells. Like I told when I was dealing with the causes as well, circulatory problems often tend to cause disease spells. The reason being, whenever a blocked artery it's supposed to carry the oxygen into the brain. The hypoxic episode into the brain will lead to the dizziness. So yes, the disease spell can be caused by the blocked arteries. And coming to the next part of the question, which is what is the question again?
With regards to the low blood pressure.
Oh yes,
symptoms. Is dizziness a symptom of low blood pressure?
Yes, low blood pressure. Yes, the blood pressure, normal blood pressure reading. If you call it low blood pressure, it is less than 90/60. There's another thing apart from the low blood pressure. Low blood pressure can be caused by dehydration, blood loss, all these things. But apart from low blood pressure per se causing the dizziness, there's something called orthostatic hypotension. Orthostatic hypotension is basically a difference in blood pressure to, more than 20 mm of systolic and more than 10 mm of diastolic, or greater than 30 beats per minute of the blood pressure, the pulse rate difference upon change of position of the patient. Even when that much of difference happens, it is called as orthostatic hypotension. Even that can be a leading cause of dizziness, especially in patients with circulatory problems and hypodynamic circulations in cases of pregnancy and others.
Great, thank you so much, doctor. Dr. Asa is asking a question: which specialty to visit for sudden onset dizziness?
It's a very good question. Sudden onset dizziness again needs to be evaluated for the causes. First dizzy episode, it's always better to consult with your general practitioner regarding the causes, and and any associated factors. Largely, I can say that there are three specialties which would be involved during the management of this disease spells. ENT being the most commonest, and for the cases of vertigo, especially the peripheral vertigo, which is most common, and a neurologist would be a second point of referral for the central vertigo, as well as other stroke related or circulatory related causes. And the third would be cardiologist to rule out any blocks, to rule out any circulatory problems again. And apart from these things, of course, the GP has to do your thyroid profiles, your blood pressure readings, blood sugar readings, and other things.
Thank you very much, doctor. Moving on towards another question, doctor, what is the difference? This is a normal question, but if you can just answer it down to a patient's understanding, what is the difference between vertigo and dizziness?
Okay, like I just mentioned, dizziness is a very common word. It's nothing but anything which is altered spatial orientation. We call it as dizziness. So that's why I have classified it into four different types of symptoms with which the patients normally come over. If the patient comes and says, I am feeling dizzy, we would like to know what sort of dizziness is that. Again, vertigo is a sensation. Clearly, it's an illusion of a patient revolving around himself. That's subjective, and the objective thing is, the other surroundings are revolving around him. So while dizziness is a very vague term, vertigo is more precise towards the illusion of movement.
Great, thank you. Doctor, an important question. This would be more of my interest also. For the past few months, I get dizzy when I turn my head quickly or bend my head down. Adding to this question, doctor, if a person sitting and then suddenly stands, suddenly that feeling comes in about dizziness or instability, what could be the cause?
This could actually be orthostatic hypotension, which I just mentioned a while back when I was answering the question on low blood pressure. Yes, the orthostatic hypotension is a very important cause of dizziness. This happens when a person moves from sitting position to standing position or sleeping position to sitting position. This happens because of the variation in the blood pressure of more than 20 mmHg systolic or more than 10 mmHg diastolic pressure, or greater than 30 beats per minute of pulse rate.
Okay, so that means if a person is having low blood pressure, in simple language, that would cause, or either a high blood pressure.
Even a normal blood pressure person can develop orthostatic hypotension. We need to again rule out pregnancy. We need to rule out other anemia in few conditions. Again, even sometimes it's more common in pregnancy also.
Great, thank you. Thank you so much, doctor. Dr. Ravi Teja is asking me a question. Some tips to combat dizziness during summer.
All right. So the important, it's a very good question actually, because during summer it's these days in the UAE especially, you need to keep yourself hydrated. Drink as much fluids as possible. You need to wear, loose comfortable wear, and it's largely keeping yourself to the comfort of the hydration, which will protect you in these summers.
Great, thank you. Doctor, moving on to another question I've got here. Good, well explained. Does dizziness occur in the morning or evening generally? What precautions are to be taken, sir? From Mr. Ramadevi. Mr. Ramadevi.
Okay. Dizziness spells can happen both in mornings and evenings, but when it signifies when it is happening more in the mornings, we need to make sure that it is not related to any motion sickness. Again, the blood pressure, also blood sugar readings has to be checked in. Although the evening ones could be largely related to the stress levels, anxieties. Again, we need to probe into other causes as well, but then largely we'll be thinking about this more of stress related or anxiety related causes for the evening onset of dizziness. And for morning ones, we need to go for your blood profile to evaluate it.
Perfect. Thank you so much, doctor. Uh, Coming to another question, doctor. Uh, Doctor, because you've covered most of the questions that has actually come up, but still I would look into can low iron cause dizziness, and why do I feel dizzy after taking iron pills?
Oh, that's a very important question actually. This has got two parts to it. I already mentioned that if your doctor diagnoses you to be iron deficient, and which is leading to your probably fatigue or dizziness that are coming up to you, he or she might be prescribing you with an iron pill, and iron medications are required in such patients to be treating your disease spells. And we often encounter dizziness associated with taking iron pills as well. When such a thing happens, it can be a sign of iron poisoning, so just talk to your doctor about the duration. Usually we advise the patients with such side effects to take iron along with food. Usually taking iron medication along with food alleviates the disease spells.
Perfect, perfect. Thank you so much, doctor. Now, once again, I would like to tell our audience for watching us at this time, you can please ask your questions in the comment section from YouTube or from Facebook. We are also live currently with LinkedIn. We have shared it there. You can ask your questions, and Dr. Ravi is here to answer those questions. Doctor, talking about the vitamins linking to the dizziness, I've heard you spoke about it earlier in your talk. The question is, what vitamin am I lacking if I get dizzy, and what food help stop dizziness? If you can just elaborate more, one more time.
Okay. Again, if the cause of the dizziness is BPPV, which is again the leading cause of peripheral vertigo, usually the vitamin D and calcium helps through the disease spells, and also the recovery as well as the attacks can be prevented. And apart from it, vitamin C will also help if again the cause is Meniere's disease, and it is proven to be useful. And vitamin C, like I told you, it is more available in strawberries, the bell peppers. It's available in all the citrus fruits. And vitamin D and calcium in all the calcium rich diet, milk products, the meat, you can just find the calcium. And for the vitamin D, yes, of course a pill can be prescribed, but again it's always in order to take any multivitamin or a vitamin per se, it's always better to discuss it with your practitioner, because in many conditions, like, we don't prescribe beyond a dose of a supplement.
Supplement. That's very important. I believe that a lot of people are taking vitamins before without consulting with their practitioner. So that's very important. Thank you, doctor. Dr. Mr. Kamesh is asking, hi doctor, is this problem likely temporary or long lasting? Problem means dizziness, the current topic.
A disease spell can, based on the cause, it can be a simple problem like a dehydration, if it is a cause, or a heat exhaustion. Can be a very temporary and self-limiting cause also. Once you hydrate yourself, you're going to be fine. On the contrary, if we're talking about a long-lasting thing like an acoustic neuroma, or a migraine, or even to any diseases that we are looking at, like a impending stroke or something, these are the ones which we need to be evaluating yourself for. I would urge that no episode of disease spell to be taken lightly. While most are not harmful, they are mostly self-limited, usually doesn't come back, but it is still always better to have a consultation with your practitioner just to evaluate the cause of it, just to be double sure that something beyond the control cause is not there.
Doctor, another important question, I believe. What are the self-care tips that would help while having an episode of dizziness? All the do's and don'ts.
Okay, again, the do's and don'ts will be simple. Once you face an episode of dizziness, just stay calm. And go slow and steady. Do not do rigorous movements. Do not bend down. That can, if at all there is a hypotension, it will further trigger the episode. Do not do vigorous movements of the head, and stay in and hydrate yourself. and use a cane, use a staircase. If at all the episode is mild, you want to go to your room or something, but never drive, never never work with heavy mechanical equipment, never do any skilled jobs which might actually have devastating effects.
That's absolutely right, Doctor. As we're moving towards the end of the session, Doctor, before that, I would like to ask you one last question. How do we fix lightheadedness when standing up?
Okay, lightheadedness while standing up can be a symptom of orthostatic hypotension, like we mentioned a while back. Yeah, the orthostatic hypotension can be fixed by medications. Okay, also we need to fix the underlying cause, like if it's a pregnancy or if it is dehydration that is a cause of it. And first thing is always identify the cause, and then next, there are prescription medications available to treat orthostatic hypotension. It's always wise to talk to your practitioner about the treatment for the orthostatic hypotension, and yes, it is manageable. Yes.
Great, thank you very much, Doctor. Doctor, thank you very much for all the information that you have given. It was a very helpful and a very well informed session about the topic that we had today about dizziness. We've really covered the causes, we've covered the assessment, we've covered the treatment. We've also covered some few cases that would had people being through. So it's a lot of information that you've given. Thank you so very much, Doctor. Before we end the session, we would really like to have take-home message from your end, and you're practicing in Prime Medical Center Barsha. If we can just look at that.
Yeah, thank you. Actually, we at Prime Medical Center Barsha Heights are very well equipped to manage the cases of dizziness, and we are also thankful that we are having all the relevant specialities available in-house. The ENT surgeon, the cardiologist and neurologist available with Prime Medical Center Barsha Heights branch, and we have a strong team of general practitioners. We are going to help you through if at all you choose us to take care of your disease spells. We are well equipped, and our specialists will also help you through depending on the issue. And we are hopeful that we will keep you all healthy, and we'll keep up to our promise that personalized care personally. Thank you so much.
Thank you so very much, Doctor. As Doctor said, personalized care personally is the motto of Prime, and we always look into that, and we always are keen to deliver this to our patients, our members, our you talk about staff and everyone. Thank you very much. If you have any questions, you can always send us an email at myprime at primehealth.ae. If you have any if you want to consult the doctor, especially in the branch, you can always book an appointment at 04707009. That's our contact number, or you can download our mobile application that has a lot of features in it, coming up with your records and health test results and everything. That is Prime Health Me app, which you can see at the bottom of your screen. The slide is running. For now, thank you very much, everyone, for watching us, for listening to us. Dr. Ravi Teja is currently practicing in Prime Medical Center Barsha branch, which is in the Onyx Tower in Barsha. They're really accessible to people who are living towards the marina and towards the Barsha side or Sheikh Zayed Road. The branch is equipped with full facilities, state-of-the-art X-ray facilities, laboratory tests, everything is available here. So you're always more than welcome to visit the branch with all the specialities here. Thank you very much for watching us. We'll be coming back to you with another live session very soon. Please do send us your feedback on our Prime Health page, recommendations, so that we can increase or make much better webinars in future as per your suggestions. Thank you very much for watching us. Take care. Till then, take care. Bye-bye.